sickness. How can we handle it effectively? What can you as a sick person do in a time of significant illness? Pray for every aspect of your treatment. Before undergoing surgery, most people pray that God would give the doctors the necessary wisdom and help. This is because they are aware of the great skill required to perform such a procedure, the complicated nature of the procedure, and the risk of complications during the operation. This is indeed a good thing. You are, however, also supposed to pray that God will take care of everything else that happens before, during, and after the operation, as complications might set in at any time. The instruments or equipment they use, or the things they need to implant into the body, could be or become defective, damaged, or non-functional during the process. Moreover, the condition of some patients may change so drastically that an operation is no longer possible, despite having been scheduled for a certain time. Medical errors could occur at any of the many points in the process of healthcare provision. Considering medication as an example, your medication might have been given to you in the wrong form. You may have been given the incorrect dosage. You could have been given the wrong medication. It may have been administered to you at the wrong time. Your medication could have expired already. The medication might have become contaminated in the manufacturing or storage process, or too little of the medication you require is available to treat your ailment effectively. Your sickness could also be misdiagnosed, resulting in the provision of the wrong treatment, and failure to provide the correct treatment. This usually starts with an insufficient examination of the patient. On the other hand, a patient with rheumatoid arthritis, for example, may have been diagnosed correctly, yet he was not prescribed all the medication required for the effective treatment of this disease. Even if he did receive all the medication required, the treatment for his disease could still be incomplete. He might not have been sent for therapy to treat the deformities and limited movement in his joints. Many people are not aware that, besides medication and surgery, other forms of health prescriptions are also critical components of the treatment for their particular disease. Whether these are done or applied at a hospital or at home, these therapies, which include exercises, foodstuffs, and other forms of treatment, all contribute to a person's recovery. These are all part of the multifaceted approach to managing your illness. The precautions and home care guidelines that form part of these treatments should be regarded as doctor's orders as well, rather than general or optional advice. Failure to follow certain precautions can even undo the gains achieved through a particular operation, such as a repair of the injured tendons in the hand. Do not think that since the common indications for these things are that it assists in, it helps with, it promotes, or it supports, that these things are not required. Regular exercise and permanently changing what a person eats, for instance, prevented the recurrence of health problems in many medical conditions. Ask God to lead you to an efficient health practitioner and clinical practice for your particular ailment. The ideal is to go where you will receive treatment that is more comprehensive and where no part of your physical or psychological function will be neglected. Not everything works for everyone, nor in the same manner. What is to the benefit of one person may be detrimental to another person, given the difference in their body makeup, the sicknesses they have and clinical presentation. The same spectacles that enable one person to see clearly can actually worsen someone else's vision. Furthermore, you need to pray for the medical personnel before your regular appointments at the clinic, hospital, or healthcare practice. In other words, pray for both major and minor medical examinations and procedures, as well as for severe, moderate, and mild diseases. A good or comprehensive medical consultation also includes sufficient education about what the illness entails, its cause, the course of the illness, its prognosis, the necessary precautions, the treatment available, a person's handling of the illness, and its home care. It is thus not simply about the treatment prescribed and administered. Philippians chapter 4 verse 6 teaches you to pray about and for everything, not only for certain things. This does not mean that you should pray a long, detailed prayer. God is able to cure you even after you prayed just a short prayer. Jeremiah's prayer was simple. Heal me, O Lord, and I shall be healed. Jeremiah 17 verse 14. Stick to the health prescriptions, take the tablets and other medications as indicated. If you must apply the bandage to your injured leg in a certain manner, follow that method. If you were told to avoid eating sweet things, refrain from doing so. If your doctor prescribed tablets or syrup, take them exactly as directed. Do not stop taking your medication because you already feel better. If the prescription therefore says, take 3 times a day for 5 days, stick to it. Failure to do so may result in an incomplete recovery. This guideline also applies to medication that you simply buy over the counter, and for which the instructions appear on the medicine insert or packet. These include natural or herbal medicines and substances. Failure to follow the prescribed instructions and guidelines can delay your recovery, lead to the worsening of your current sickness, or cause the development of complications. The same medication that can bring about recovery could also lead to your death if taken in large quantities all at once, since you have then overdosed yourself. Mixing your medication, or taking certain medication prescribed for someone else, could also result in adverse effects. Furthermore, you need to adhere to the doctor's orders or prescriptions accompanying your medication. Failure to cut down on salty foods if suffering from hypertension can lead to a stroke. Failure to take proper care of your wound can lead to severe infection. Who are you then going to blame? Just yourself or your own stubbornness? Would the Israelites have been protected against all kinds of infections from the parasites in the desert, if they had not followed the instructions contained in Leviticus chapter 11 to 15? Definitely not. These included prescriptions regarding the cleansing of the body, the burning of infected clothing, and the eating and handling of certain foodstuffs. In Exodus chapter 16 verses 19 and 20, a description is given of how people did not obey God's instruction that they should not leave any food until the next day. The result was that it subsequently bred worms and stank, which was definitely a serious health risk for whoever might have attempted to eat it. Ask God's blessing on your medication and medical devices. Before you use anything that you take into, apply to, use on, or use for your body and mind, you must seek His blessing. It thus includes tablets, medicine syrup, injections, wound care products, skincare items, body patches, bandages, dressings, cream, lotion, ointment, equipment, and assistive devices. Praying every time before using these items will help prevent or minimize any short-term or long-term side effects. Your healthcare practitioner or even the medical or pharmaceutical industry might not be aware of these, due to insufficient research or information regarding the use of these products in certain illnesses. Do not only pray for items that are normally found in a standard pharmacy, but pray for everything you use for the improvement of your health. James chapter 5 verse 15 teaches how critical prayer is when one desires God's healing. And the prayer of faith shall save the sick, and the Lord shall raise him up. If the Lord is able to raise a person from the dead, then surely He is also able to raise someone from a bed of severe illness, since there is still life in the body of that person. Many Christians thank God for the food they eat, yet fail to thank Him for the medication they take in. Would they, however, have been more mindful to thank God if there was an expression such as, "Eat your medication"? Sick people who cannot eat or drink foodstuffs by themselves are still being fed through other means, such as tubes. For such a person who might not be mentally alert or responsive, it is the caregiver's responsibility to pray for God's blessing on everything that enters the body.